Weil Foot and Ankle Institute corrects more bunions than any other podiatry practice in the United States. We always have patients asking us what that experience is like. So we've put together a video for you to see what it's like to have your bunions corrected.
Okay, so long story short, I've just had bunions for a really long time, and they were super painful, and I'm on my feet for work. I'm like super athletic, and it's kind of made it worse over the years. But yeah, there's days where, like, at the end of the day, like, I can't even, I'm in so much pain.
Are you totally comfortable in gym shoes?
No. But they're the best. I'm a personal trainer, and I bartend twice a week, and I'm pretty much on my feet constantly. I DJ a little bit here and there. So.
Do your feet prevent you from doing any of those things? Or
I'm just in a lot of pain at the end of the day, and I'm just kind of like, I mean, I've been taking Advil, like, every day for the last year, probably.
Wow.
So,
what else have you done, even if it hasn't worked, what else have you tried to do to make it feel better?
I did the orthotics thing years ago. Hated them. Just maybe I had the wrong ones. I've just kind of like not lived my life like kind of like how I'm used to.
Anybody in your family have bunions? Mom, Dad?
All my aunts on my mom's side and my mom.
Okay. Bunions are genetic. Really, what a bunion is, it's not a bump that grows. It's actually bones that change position over time, and that's what's genetic about the problem. So there's a bone right here that should sit where my finger is, but instead it's moved and moved and moved out of position over time, and you've seen it change. Sure. Well, as that moves out of position over time, that bone is sticking out, but then the mechanics and muscles and pull of your foot, as the bone goes this way, the toe is then pulled over this way. So where these two bones should be sitting in alignment, they're getting out of alignment. So you're getting increased pressure in the middle of your foot because this isn't taking up the pressure that it should. So that's why you're getting some of the pain that you're experiencing in this part of your foot. It couldn't have been prevented. The athletics you did, the shoes that you wear had minimal effect on this. This was going to happen no matter what. And even if we put you in special shoes or orthotics or braces to hold your toe straight,
I feel like it would have still...
It wouldn't have, for sure. We just know from research that that's the case. Yeah. This was going to happen no matter what.
Sure.
What are your options at this point? Well, one option is to keep doing what you're doing. Try to find shoes that feel better, stick with gym shoes, kind of deal with the fact that at the end of the day, your feet are sore. I'm not trying to tell you that's the option you should pursue, but that's certainly an option. Using orthotics or any spacers really doesn't make a big impact, as you have already found. The other option to consider is surgery to correct the problems. And what we do surgically is we literally cut and reposition the bones that have changed position. So we cut a bone here, we realign it, we cut a bone here, we realign it. So we're getting the bones in the position that they're supposed to be. When we cut and reposition those bones, we put small screws or pins into the bone that are all underneath your skin, and they stay there pretty much forever. And they hold the position of the bone in place so the bone heals where we want it to. Also during the surgery, we tighten some tissue that's too loose, and we loosen some tissue that's too tight. So not only are we correcting the bunion, it should be there to stay. Now, if you look at the world data and research on bunions, about 10 to 15% of bunions after they've been corrected come back. Our data that we've published, we have about a 2 to 3% recurrence rate. So although it still can happen, it's pretty rare that it does. When we do the surgery, it's outpatient surgery, meaning that you come and go on the same day. You're asleep, unaware of anything that's going on around you, but you're breathing on your own, so it's very safe. While you're asleep, we give you shots into your feet to make them numb, and we can see the inside of your foot so that afterwards, when you stand, your scar will actually disappear, no one will scribe, and it takes about 30 minutes per foot to do the surgery. So we could get the whole thing done if you did both feet in about an hour. After the surgery is done, you'll wake up, you'll have a bandage on your foot, a big bulky bandage on your foot, and then you'll have surgical shoes on your feet. When I say surgical shoes, like the wooden bottom slippers with Velcro straps. It's not a boot or anything like that. It's just a wooden bottom sandal. You'll be in bandage and a surgical shoe for 1 week. You're home and you're off your feet. And when I say you're off your feet, you are on your feet only to walk from the bed to the couch to the bathroom. And that's about it. You're sitting like you are right now. Your feet are elevated, maybe on a pillow or two, but not much higher than you are right now. Your feet will be numb for typically a day or two after surgery, so there's not too much pain afterwards. Very rarely do people take much pain medicine. They usually come back and see me a week after surgery and say, wow, I barely had any pain, if they follow my directions. And then you come back and see me a week after surgery, we take your bandages off, and you'll go back into gym shoes, be able to start bathing. We do not use any stitches that have to be removed. Everything's underneath your skin. So you'll be able to take a shower a week after surgery and get your feet wet. We also start physical therapy a week after surgery, a couple of times a week with a therapist, but doing things once or twice a day on your own. And that's to get your strength back, your flexibility, your balance. And that's a real important part of the recovery process. First week in gym shoes, you're on your feet for 10 or 15 minutes here and there, equaling a total of maybe an hour to an hour and a half on your feet in the entire day. Each week, you'll be able to add about an hour of time to that total. You can drive a car, and you can start to be on your feet, as I already said, a little bit more. You can even begin working out as long as it's non-weight bearing. 6 to 8 weeks after surgery, you will start to move from your gym shoes and more into the other shoes that you want to wear, fashionable shoes, things like that.
Is there extra skin where the bunion was? You probably saw that on, right?
Well, so the extra skin that's there actually shrinks over time. When I talk about whether we should do 1 or 2 feet, not a lot of people will do 2 feet at the same time. Not a lot of surgeons will. But the way in which our technique has been developed allows for us to do both feet at the same time. Allows us to get back in gym shoes in a week. And the value of doing both feet at the same time are that the recovery that I just talked about doesn't change if we do 1 foot or we do 2 feet. And of the people who have had both feet done at the same time, 97% say they would do both feet at the same time again.
Sure, yeah.
So that's a pretty good number.
You don't have to go under twice either.
Exactly.